There's a lot of unknown with treatments and how it will impact my long-term health. I don't know. From treatment to treatment, every treatment is different. It is something you kind of struggle with internally, knowing that there's so much unknown. You know a little bit about a lot of things, but you don't know everything. And so it kind of is a scary thought to look at the future and wonder that if the treatments I'm doing now that have saved my life, if that's going to impact my future.
I am concerned about my long-term health. As I get older, I do notice some changes that are within my body. That I just developed a gluten allergy, so I've excluded gluten from my diet and I feel a whole lot better. But I have no idea what the future holds with my condition and my body. I feel new aches and pains. I have to do new strategies and techniques to overcome some of the things that I experienced today that I didn't 12 years ago.
I am very concerned about the long-term treatment. I actually have occasional nightmares, which I talk to my family about. As time goes on, what if I can't manage myself? What if it got to the point where I had some crisis and nobody was around to help me?
I worry about the long-term results. I think about moving in with my mom. I worry about how I'm going to take care of myself. I worry about how I'm going to take care of my kids. And I don't want to put that burden on other people.
My long-term health and the link to hypoparathyroidism, first and foremost, includes staying stable and to try to limit the fluctuation in the calcium levels in my blood on a daily basis. On the longer term, of course, is my kidneys. I want to try to protect my kidneys as best I can and stay informed with this condition that I live with daily.
I am concerned about my treatment and how it's going to affect me later on, because I'm pushing 50 and it already limits me. So I'm wondering, okay, as I'm getting older, how much more am I going to be limited? Not just, just because of old age, but from the illness itself. And I try to be active, and I want to be, as far as like riding bikes and stuff like that, but I just really concerned if it's going to really limit me.
It's very concerning when I listen to the presenters at the conference. It can be a little overwhelming to hear some of the possible long-term effects of the disorder. At the same time, I'm quite fortunate so far to have not experienced those things. The kidney issues, I hear about calcifications in the brain and cataracts and, a lot of long-term conditions that could happen. And it does concern me, and I'm glad to know about them, because then we can be looking for them and maybe head things off.
You have to live for now, you have to live in the present, and that's my attitude. You try to stay positive, you treat it now so you feel good now and live your life, and don't anticipate what we don't know yet.